CEN Written Exams Instructions. Question 1. A patient who is a minor, under 18, is brought to the ED with a life-threatening condition. The parents cannot be reached. The CEN should: Option A. Wait until the parents are reached. Option B. Provide life-saving treatment under implied consent. Option C. Call Child Protective Services. Option D. Transfer the patient to another hospital. The correct answer is option B. Provide life-saving treatment under implied consent. In emergencies, implied consent allows healthcare providers to treat a minor without parental consent when the patient's life or limb is in danger and a delay could cause harm. The CEN should also notify the parents and CPS as required. This is part of the EMTALA requirements. Question 2. A patient presents with a sudden onset of a severe headache, nuchal rigidity, and photophobia. The CEN should suspect: Option A. Meningitis. Option B. Subarachnoid hemorrhage. Option C. Migraine. Option D. Both A and B. The correct answer is option D. Both A and B. Meningitis and subarachnoid hemorrhage share classic signs: severe headache, nuchal rigidity, and photophobia. The differentiation is made with imaging, CT for SAH, and lumbar puncture, LP for meningitis. Treatment for both is emergent. A non-contrast CT head is often the first test for SAH, LP is used for meningitis and if CT is negative for SAH. Question 3. A patient presents with an animal bite, likely a dog bite. The wound is deep and contaminated. The CEN should: Option A. Irrigate the wound and close it primarily. Option B. Irrigate, debride, and administer rabies prophylaxis. Option C. Administer antibiotics only. Option D. Apply a pressure dressing. The correct answer is option B. Irrigate, debride, and administer rabies prophylaxis. Animal bites, particularly from wild animals, require thorough irrigation, debridement, and rabies prophylaxis, post-exposure prophylaxis, PEP. Primary closure is generally not recommended to prevent infection. Antibiotics are indicated for high-risk wounds, e.g., deep, contaminated, or on the face. Tetanus prophylaxis is also indicated. Question 4. A patient has a suspected tension pneumothorax with tracheal deviation, unilateral absent breath sounds, and hypotension. What is the priority intervention? Option A. Chest X-ray. Option B. Needle decompression. Option C. Chest tube insertion. Option D. Oxygen therapy. The correct answer is option B. Needle decompression. Tension pneumothorax is a life-threatening emergency requiring immediate needle decompression, second intercostal space, mid-clavicular line, or finger thoracostomy. The condition causes mediastinal shift, impaired venous return, and shock. Chest X-ray should not delay treatment. Chest tube insertion follows needle decompression. Oxygen is adjunctive but not the priority. Question 5. A patient with acute stroke has aphasia. The CEN should: Option A. Speak loudly and slowly. Option B. Use simple, short sentences and allow time for response. Option C. Avoid speaking to prevent frustration. Option D. Write everything down. The correct answer is option B. Use simple, short sentences and allow time for response. Aphasia, language impairment, often expressive or receptive, in stroke patients requires patience and clear, simple communication. Speaking slowly and using short sentences reduces cognitive load. Speaking loudly is not helpful as aphasia is not a hearing problem. Avoidance limits communication. Writing may help some patients but should be combined with verbal cues. Speech therapy consultation is appropriate. Question 6. Which of the following is a classic finding in a patient with pericarditis? Option A. ST segment elevation in all leads. Option B. PR segment depression. Option C, chest pain that worsens with inspiration. Option D, all of the above. The correct answer is option D, all of the above. Pericarditis presents with diffuse ST segment elevation, often concave upward, PR segment depression, and chest pain that is pleuritic, worse with inspiration, and better leaning forward. It is often viral in origin. Treatment includes NSAIDs, colchicine, and steroids if refractory. Question 7. A patient with a psychiatric emergency is placed on a legal hold, e.g., 5150. The CEN should: Option A, allow the patient to leave if they are calm. Option B, inform the patient they are on a legal hold and document. Option C, call the police to discharge the patient. Option D, ignore the legal hold. The correct answer is option B. Inform the patient they are on a legal hold and document. Patients on a legal hold, involuntary psychiatric hold, are not allowed to leave until they are evaluated. The CEN should inform the patient of the hold and document the process. The patient must be kept safe and in a monitored environment. The hold is a legal order, and leaving would be against the law. The CEN should not discharge the patient. Question 8. A patient with a suspected stroke is being evaluated. The CEN should: Option A, perform a focused assessment, FAST, face, arms, speech, time. Option B, obtain a CT head. Option C, check the blood glucose. Option D, all of the above. The correct answer is option D, all of the above. Stroke assessment includes a focused FAST, face, arms, speech, time, examination, CT head to rule out hemorrhage, and blood glucose check to rule out hypoglycemia, which can mimic stroke. This is part of the emergency stroke protocol. A CT head is essential before TPA administration. Question 9. A patient with a history of HIV/AIDS presents with a fever and dyspnea. The CEN should suspect: Option A, pneumocystis jirovecii pneumonia, PCP. Option B, tuberculosis. Option C, bacterial pneumonia. Option D, all of the above. The correct answer is option D, all of the above. Patients with HIV/AIDS are immunocompromised and susceptible to a range of opportunistic infections. PCP, pneumocystis jirovecii pneumonia, is a common cause of pneumonia in HIV patients. Tuberculosis and bacterial pneumonia are also possible. The CEN should implement appropriate isolation precautions, airborne for TB, droplet for others, while evaluating the cause. Question 10. A 55-year-old male presents with chest pain radiating to the jaw, diaphoresis, and nausea. The 12-lead ECG shows ST segment elevation in leads V1 V4. Which intervention is the priority? Option A, administer morphine 4 mg 4. Option B, administer aspirin 324 mg chewed. Option C, prepare for emergent percutaneous coronary intervention, PCI. Option D, obtain a chest X-ray. The correct answer is option C. Prepare for emergent percutaneous coronary intervention, PCI. This patient is experiencing an ST segment elevation myocardial infarction, STEMI, indicated by ST elevation in anterior leads V1 V4. The priority is rapid reperfusion. The goal is door-to-balloon time of 90 minutes or less for PCI. While aspirin and morphine are important adjuncts, they do not address the underlying occlusion. Chest X-ray is not the priority. Door-to-needle for fibrinolysis is 30 minutes if PCI is not available. Question 11. A patient with cardiogenic shock has a cardiac index 2.2 L/min/m superscript 2 and elevated filling pressures. Which finding would the CEN expect? Option A, warm, dry skin. Option B, cool, clammy skin. Option C, bounding pulses. Option D, widened pulse pressure. The correct answer is option B, cool, Clammy skin. Cardiogenic shock is characterized by decreased cardiac output and increased systemic vascular resistance, SVR, resulting in cool, clammy skin, oliguria, and hypotension. This is in contrast to distributive shock, septic or neurogenic, where skin is warm and dry due to vasodilation. Management includes inotropic support, dobutamine, and vasopressors, norepinephrine. Question 12. A patient with a pulmonary embolus is receiving heparin. The CEN should monitor for which complication? Option A, bleeding. Option B, heparin-induced thrombocytopenia, HIT. Option C, allergic reaction. Option D, all of the above. The correct answer is option D, all of the above. Heparin has multiple complications: bleeding, due to anticoagulation, HIT, immune-mediated thrombocytopenia, and allergic reactions. Monitoring includes APTT, for therapeutic effect, platelet count, for HIT, and bleeding assessments. HIT should be suspected if the platelet count drops significantly. Alternatives include direct thrombin inhibitors, argatroban, if HIT occurs. Question 13. A patient with a suspected pneumothorax has unilateral decreased breath sounds and tracheal deviation. The CEN should: Option A, administer supplemental oxygen. Option B, prepare for needle decompression. Option C, obtain a chest X-ray. Option D, place the patient in a supine position. The correct answer is option B, prepare for needle decompression. Tracheal deviation with decreased breath sounds suggests attention pneumothorax, a life-threatening emergency requiring immediate needle decompression. Oxygen is given but does not treat the underlying pathology. Chest X-ray should not delay treatment. The patient should be positioned upright if possible. A supine position can make the diagnosis more difficult. Question 14. A patient with frostbite to the fingers should be managed with: Option A, rapid Ruhrmeng in water at 37 to 40 degrees Celsius. Option B, dry heat, e.g., warm blankets. Option C, massage to the affected area. Option D, surgical debridement. The correct answer is option A, rapid Ruhrmeng in water at 37 to 40 degrees Celsius. Frostbite is managed with rapid Ruhrmeng in warm water at 37 to 40 degrees Celsius, 98.6 to 104 degrees Fahrenheit, for 15 to 30 minutes. Ruhrmeng should be done until the tissues are thawed. Analgesia is needed due to pain. Dry heat, e.g., warm blankets, is not recommended as it can cause burn injuries. Massage can cause tissue damage. Surgical debridement may be necessary after Ruhrmeng if necrosis occurs. Question 15. A patient with a DNR, do not resuscitate, order is in cardiac arrest. The CEN should: Option A, start CPR immediately. Option B, confirm the DNR status and not start CPR. Option C, call the family for permission. Option D, ask the patient's primary nurse. The correct answer is option B, confirm the DNR status and not start CPR. If a patient has a valid DNR order, advance directive, the healthcare team should not initiate CPR. The CEN should confirm the DNR status before withholding CPR. If the DNR is not immediately available, the CEN should initiate CPR unless the patient's status is known and documented. The family's permission is not required if the DNR is valid. Question 16. A patient with suspected influenza should be placed on which type of precautions? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option B, droplet precautions. Influenza is transmitted via respiratory droplets, coughing, sneezing, or talking. Patients with suspected influenza should be placed on droplet precautions, a surgical mask within 3 feet of the patient, and the patient should wear a mask when leaving the room. Airborne precautions are for TB and measles. Contact precautions are for C. diff and MRSA. Question 17. A patient with COPD presents with severe dyspnea, confusion, and cyanosis. ABG shows pH 7.25, PaCO2 65 mmHg, PaO2 55 mmHg. The CEN should anticipate. Option A. Non-invasive positive pressure ventilation, BiPAP. Option B. High-flow oxygen via non-rebreather mask. Option C. Bronchodilators only. Option D. Immediate intubation. The correct answer is option A. Non-invasive positive pressure ventilation, BiPAP. This patient is in acute respiratory failure with hypercapnia and acidosis. BiPAP is the first-line intervention for COPD exacerbations with respiratory acidosis, as it can reduce the need for intubation. High-flow oxygen should be used cautiously in COPD patients to avoid suppressing the hypoxic drive. Bronchodilators should be given, but BiPAP is the priority for this acidotic patient. Question 18. A patient presents with a sudden onset of fever, chills, and hypotension. The patient is a chemotherapy patient and has a central line. The CEN should suspect. Option A. Sepsis, bacteremia. Option B. Febrile neutropenia. Option C. Anaphylaxis. Option D. Pulmonary embolism. The correct answer is option B. Febrile neutropenia. Patients with chemotherapy-induced neutropenia are at high risk for infection and sepsis. A single temperature 38.3 degrees Celsius, or 38 degrees Celsius for more than 1 hour, is an emergency. Cultures, blood, urine, sputum, should be obtained, and broad-spectrum antibiotics should be given promptly. The patient is at high risk for bacteremia and septic shock. This is a medical emergency. Question 19. Which of the following is a clinical feature of a pulmonary contusion? Option A. Hemoptysis. Option B. Chest wall crepitus. Option C. Subcutaneous emphysema. Option D. Unilateral wheezing. The correct answer is option A. Hemoptysis. Pulmonary contusion, bruising of lung tissue, often results from blunt chest trauma. Clinical features include hemoptysis, hypoxia, and opacities on chest X-ray that develop over 24 to 48 hours. Chest wall crepitus and subcutaneous emphysema suggest pneumothorax or rib fracture. Unilateral wheezing suggests a foreign body or bronchial obstruction. Treatment is supportive with oxygen and pain control. Question 20. A patient with a suspected stroke has a blood pressure of 190/105 mmHg. The CEN should. Option A. Administer 4-labetalol to lower blood pressure. Option B. Permit hypertension unless the patient is receiving TPA. Option C. Administer sublingual nifedipine. Option D. Start a nitroprusside drip. The correct answer is option B. Permit hypertension unless the patient is receiving TPA. In acute ischemic stroke, hypertension is often permissive to maintain cerebral perfusion pressure, CPP, in the ischemic penumbra. Routine blood pressure lowering is not recommended unless the patient is a candidate for TPA, in which case BP should be lowered to 185/110 mmHg before TPA administration. After TPA, BP should be maintained 180/105 mmHg. Question 21. A patient presents with sudden, painless vision loss in one eye. Which diagnosis is most likely? Option A. Central retinal artery occlusion, CRAO. Option B. Retinal detachment. Option C. Acute angle closure glaucoma. Option D. Optic neuritis. The correct answer is option A. Central retinal artery occlusion, CRAO. CRAO presents with sudden, painless, monocular vision loss. It is an ophthalmic emergency requiring immediate evaluation for a source of emboli. The patient may have a cherry red spot on the macula. Treatment includes ocular massage, lowering intraocular pressure, IOP, and possibly thrombolysis if the patient is within the window. Retinal detachment presents with flashing lights and floaters. Question 22. A patient with a seizure disorder is in status epilepticus. The CEN should administer. Option A lorazepam, Ativan, 4 mg 4. Option B phenytoin, dilantin, 20 mg/kg 4. Option C midazolam, Versed, 10 mg IM. Option D valproic acid 20 mg/kg 4. The correct answer is option A. Lorazepam, Ativan, 4 mg 4. Lorazepam is the first-line treatment for status epilepticus. It is a benzodiazepine that terminates seizures. If the seizure continues, phenytoin or fosphenytoin is given. Midazolam may be used if 4-access is not available, IM. Valproic acid is a third-line option. Airway management and ABCs are priorities. Question 23. A patient presents with a severe headache, fever, nuchal rigidity, and altered mental status. Which diagnosis should the CEN suspect? Option A migraine. Option B meningitis. Option C subarachnoid hemorrhage. Option D temporal arteritis. The correct answer is option B. Meningitis. The classic triad for meningitis is headache, fever, and nuchal rigidity, neck stiffness, often accompanied by altered mental status, photophobia, and vomiting. Prompt antibiotics, within 60 minutes of suspicion, are critical. LP confirms the diagnosis. The patient should be placed on droplet precautions initially. Empirical antibiotics include vancomycin, ceftriaxone, and ampicillin. Question 24. A patient with suspected C. difficile infection should be placed on which type of precautions? Option A contact precautions. Option B droplet precautions. Option C airborne precautions. Option D standard precautions. The correct answer is option A. Contact precautions. C. difficile is transmitted via the fecal-oral route, contact with contaminated surfaces or feces. Patients should be placed on contact precautions, gloves and gowns, with hand hygiene using soap and water. Alcohol-based hand rub is not effective against C. diff spores. Private room is preferred. Droplet and airborne precautions are for respiratory infections. Question 25. A patient with a head injury has a GCS of 8. The CEN should: Option A intubate the patient. Option B elevate the head of the bed to 30 degrees. Option C administer mannitol. Option D. All of the above. The correct answer is option D. All of the above. A GCS8 indicates severe head injury and a need for airway protection and management of elevated ICP. Intubation is indicated to protect the airway and manage ventilation. Head elevation to 30 degrees reduces ICP. Mannitol or hypertonic saline is used to reduce ICP. All interventions are indicated in severe head injury.